Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is February 19th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 111 million cases and over 2.4 million deaths. In the United States, we have over 28.5 million cases and over 507,000 deaths. Let's talk about the biggest news that happened this week, which is the winter storm and frigid temperatures that hit much of the United States. Oklahoma and Texas have seen the biggest consequences, but other states in the nation have also been affected. The cold, snow, and wind have caused power outages in many areas, and some people have even died due to traffic accidents, fires, and carbon monoxide poisoning. President Biden has declared a state of emergency in Texas and Oklahoma. And over 4 million people in Texas alone were at one time without power. Currently, over 100,000 people still do not have power. Safe drinking water is even harder to come by than power because of the water pipes which froze and then burst. Bottled water is sold out in many communities, and some people are even resorting to boiling snow to get water. There are a number of things to talk about relating to this disaster that are dealing with public health. First is providing for all those people who are in need of heat, food, water, and other supplies. FEMA is mobilizing to help in that regard, and I'm sure many other organizations will also be helping as well. If you're able to do so, please donate to any trustworthy organizations that state that they are going to be helping there. Another public health related issue here is on the environmental side. Scientists are certain that man-made global warming is a thing. There's just too much evidence out there for it not to be a thing. There's always going to be outliers in some studies, but there is just a huge amount of evidence from multiple studies, multiple scientists, multiple organizations. There's just so much evidence that man-made stuff is happening. The climate change is being affected by man. I'm sure that there are probably other things going on too, like natural cycles. Maybe it's the wrath of God or something like that. We don't know at this point as far as any of that goes, because the only thing we can prove scientifically is that yes, man has done things that have caused climate change. Like I said, there's probably a bunch of other reasons for this too, but part of it is definitely that it's man-made. So this global warming, we cannot tell 100% whether any specific weather situations, for example, these winter storms right now, if they are a consequence of global warming. We just don't have the technology to be able to track stuff that closely. But the likelihood of these storms being related to it is very high, based on what we do know. Also, many climate change models do show that even though we often call it global warming, warming in some areas can cause cooling in other areas. In fact, in this case, what we expect has happened is that what normally keeps the Arctic air in the north, in the Arctic, has broken down due to the climate change. And that's why it's been pushed down. We have this polar vortex. And the polar vortex didn't really used to be a thing just a few years ago, but it's become increasingly common. Almost every year over the last 10 years, we've had some sort of level of polar vortex. And that's part of what has been happening with this storm. Basically, the Arctic air pushed down way into the south, further than it usually does, and we got this. And that does seem to be related to the global warming. So we do need to make sure that we're trying to stop all these man-made climate changes, or at least reduce them to the point where they're not as dangerous. Some politicians this week were quick to blame freezing wind turbines on power outages, but the reality is that the wind turbines, yes, some did freeze, but they make up a small percentage of the power outages compared to natural gas. Natural gas is a huge portion of where Texas gets its energy. And the vast majority of the power outages were caused by frozen either natural gas lines or the equipment to help with the pumping and storing and all that of the natural gas. It really was a failure on the part of preparation, not any one individual technology, but just a failure of people preparing. All of this could have been avoided if they had prepared well enough. Yes, Texas doesn't usually have this kind of cold, and so there's the argument to be made that, why prepare for something if it's only going to happen every every decade or a couple decades or whatever. Well, it happened in 2011, not quite as bad as this time, but it was still bad enough that there were a bunch of reports made. There were warnings given. People were told that you need to prepare because this will happen again. They were told to do insulation. They were told to increase their technologies that would heat areas better to avoid this kind of thing. They didn't do it. Pretty much, the state didn't do it. Almost no cities did it. One city that did take that advice to heart was El Paso. And this time around, El Paso didn't have any problems. They still got just as cold as any other place in Texas, pretty much. And they didn't lose power. They were fine. So it's the real blame here goes on those who should have prepared. It's not because of wind turbines or anything like that. They have wind turbines in the Arctic that work just fine. It's just that they're prepared. They're set up the right way. They have the de-icing. They have the correct lubricant that doesn't freeze. Everything that they need, they have it set up. And they just didn't have that in Texas because they just didn't expect it to get that cold. So it's just a matter of preparing correctly. So a disaster is not the time to start pointing fingers. Of course, that's what politicians do, especially the last few years have been big on that. But in reality, as a people, we need to step away from that and just say, hey, we need to get stuff prepared. Who cares who's to blame? Let's just fix it. That's what we need. Fossil fuels will eventually run out. Regardless of what you feel about fossil fuels right now, they will eventually run out, and for the most part, they do pollute more than their renewable energy counterparts. So we do need to get rid of fossil fuels eventually. Getting rid of them all at once and before we have something else in place would be a disaster. We can't do that, but we do need to work on it. We need to start now. We need to start pushing for the renewable energy as much as possible. One of the big things with Texas and a lot of places around the United States and throughout the world is that natural gas and oil are big money makers for states and for countries. And that is definitely playing a part here. So we can't just take people's livelihoods away and just get rid of everything, but we need to have some plan in place to eventually get away from the fossil fuels and get to the renewable energy. I'm not smart enough to decide how quickly that goes. Other people need to decide that, but we do need to have that plan in place, and we do need to be moving away from fossil fuels gradually. So let's pivot to COVID-19, what we usually talk about most weeks. Right now, daily vaccination numbers in the United States are going up. This is a definite good thing. The storm did cause affected areas to have to close down some of the vaccination places. So that's a temporary setback, but overall we are seeing increases, and so this is great. We're getting more vaccines to people. More people that need the vaccines are getting them. We're getting closer to the point where just regular people that aren't in any specific categories are going to be able to start getting the vaccines. So this is really good news. Also, results from vaccination programs in Israel have shown that the Pfizer vaccine is over 90% effective there. So this is real-world results, not just the tests. But this does show that the trials, the phase 1, 2, and 3 trials that were done by Pfizer were accurate. A lot of people alleged that because the whole production seemed rushed, that they hadn't done it correctly. Well, this shows that, yes, it was done correctly because even real-world results are showing the same percentages of effectiveness. New studies, however, do show that both the Pfizer and Moderna vaccines aren't quite as effective against many of the newer variants. They still will protect you from getting severe illness, but they're just not as effective at keeping you from getting the COVID-19 completely. Definitely still better to get the vaccine than not, by far. Definitely get the vaccine. It's just that some of these new variants are a bit harder to block. Speaking of variants, we briefly mentioned a few reports ago that there was a new variant that showed up in California. Well, now we've learned this week that the variant from the UK, B117, and that California variant have actually merged, and they formed a new variant. This could be good or bad. It could be good in that maybe some things got canceled out, and so maybe it's not quite as dangerous, but it also could be bad. And most scientists are thinking that most likely it's going to be bad for us because usually viruses mutate and keep mutations in such a way that they make it better for themselves, not for us. And so we need to make sure that we are getting people vaccinated as quickly as possible so that we can avoid things like this. We don't want variants to merge together because usually it ends up bad. The AstraZeneca vaccine has been approved by the World Health Organization. Many countries wait for the World Health Organization to approve something before they'll actually administer it in their own country. And so this is a big step, especially for developing countries, which tend to be the ones that wait the most for the World Health Organization to approve things. The University of Oxford, which worked with AstraZeneca on the vaccine, is now expanding its vaccine study to include children as young as 6 years old. Up until this time, all of our approved vaccines have only been approved for either adults or for older teens, like 16 years old and above. So this will be a big step towards getting everyone vaccinated, including children, if these trials work out well. The CDC is reminding everyone that even though COVID-19 cases are dropping and things are looking better, we're not out of the woods yet. We still have the variants to worry about. We really don't know what's going to happen with those. We hope we can beat them in the race to get everyone vaccinated, but who knows? So we're still need to be aware of those, and we need to make sure that we're still following the guidelines, because those guidelines of wearing a mask, avoiding large crowds, practicing social distancing, and washing hands, they work on all variants. It's, vaccinations are nice because it makes it so we don't have to follow those guidelines if everyone is vaccinated. But while we wait for that, all these guidelines will keep us safe if we just follow them. Of course, they're not 100% effective, but they are very effective. Like we talked about last week, masking up, especially double masking, can block over 90% of particles. So if you're doing things right, you're likely not going to be infected with COVID-19, and you're also likely not going to spread it to others if you do happen to get it. So we need to be doing all of these guidelines in order to slow the spread until the vaccine can be given to everyone. So thank you for watching Plain English Public Health Weekly Report for February 19th, 2021. As always, we've got links below the video for things that we weren't able to talk about this week and more information on things we did talk about this week. I'm Richard Greenland, and you have a healthy weekend.